COVID-19 Prevention Awareness. What can I do about COVID-19? We can all play a part in preventing the transfer of communicable diseases and spreading viruses. COVID-19 and the flu virus are easy to contract through close contact with people at work. The best defense is washing hands vigilantly, many times per day, with soap and water. This is the most effective means to prevent the spread of the virus and prevent against infection. Employee responsibilities. Complete pre-screening questionnaire accurately and honestly and return promptly to the office. Report symptoms immediately to protect fellow workers. Follow provincial health guidelines and company procedures to social distance and isolate as required. Remain healthy and active with these guidelines. Be vigilant about washing hands and hygiene using shirt sleeves to open doors. Wipe down surfaces with soap, water, or disinfectant, and do not cross-contaminate. Other personal measures for prevention. Wash hands frequently. Provincial authorities recommend vaccinations. Stay home if you are sick, so you do not spread the illness to other people. Use a tissue or cough and sneeze into your arm, not your hand. Turn away from other people. Use single-use tissues. Dispose of the tissue immediately. Wash your hands after coughing, sneezing, or using tissues. Do not touch your eyes, nose, or mouth. Viruses can transfer from your hands into your body. Do not share cups, glasses, dishes, or cutlery. Did we mention washing your hands frequently? When not to work. Anyone with COVID-19-like symptoms, a sore throat, fever, sneezing, or coughing must self-isolate. Workers who have traveled internationally. If you share a residence with a person that has been exposed to COVID-19. Workers who have been exposed to anyone confirmed to have COVID-19 or anyone with possible symptoms of COVID-19 should call HealthLink BC at 811 for an assessment and to determine any necessary next steps. What is my employer doing to prevent or reduce the spread of infection? We are committed to prevention of all communicable diseases and the spread of any viruses, including colds, flus, and COVID-19. We are progressive in our efforts to educate our employees, provide a hygienic working environment, stay current with public health advisories. Our training, orientations, hygiene, and disinfecting policies are constantly evolving. We are innovative in identifying new ways to manage our work and workforce without cross-contamination and utilizing isolation to protect our workers and the communities in which we work. What are the supervisor responsibilities? Supervisors must ensure both sanitation and social distancing are happening. Everyone must follow procedures. Supervisors must observe, document, and correct if necessary. Supervisors must check the physical health of workers daily. Maintain a daily log and health screening checklist of employees present at the worksite. If someone presents ill, the supervisor must follow and have the worker use a self-assessment tool. If a worker is required to self-isolate, refer to and follow the isolation procedures. Document all work absences and suspected communicable disease cases. Monitor for changes from baseline illness rate and report to provincial authorities alert phase if 2 cases present. Train workers in the worksite procedures to prevent contamination and exposure, especially physical distancing in their daily tasks. Share the exposure control plan and procedures with workers and post the controls and procedures. Ensure workers use PPE, gloves and respirators, bandanas, masks, and trained to use them properly. Ensure physical distancing, 2 meters or 6 feet, is maintained. Direct work in a manner that eliminates or minimizes the risk to workers. Have a work plan. Monitor all activity, document observations, and immediately correct non-conformance. All non-conformance events will be documented. Assist in the selection of controls to eliminate or minimize the risk of worker exposures. Ensure all related safety documents and records are properly maintained. Frequently asked questions. What does physical distancing look like at the work site? When should I wash my hands? How will we maintain physical distancing during transportation? What additional PPE will be required? What does my accommodations look like? What will the community interface look like? What if I get sick? Physical distancing. We must practice social distancing recommendations including avoid touch-based greetings such as handshakes and hugs. Keep a distance of at least 2 arms length, approximately 2 meters or 6 feet from others. At the work site, things will look different. Staggered crew start times, staggered break and lunch times, limited number of workers in each area, holding site meetings in open spaces or outside, lines painted to define eating areas. Hand washing. Hand washing stations are available on the work site. Wash your hands if you have just coughed or sneezed, you have just handled communal objects or shared tools, equipment, paperwork, after you leave a work area, if you are about to eat or prepare food, if you have just used the washroom, or if your hands are visibly dirty. Use soap, warm running water. If the water is not available, use a waterless hand sanitizer that has at least 60% alcohol. Hand washing procedure. Press hands palm to palm. Press each palm over back of opposing hand. Interlace fingers palm to palm. Interlock fingers. Rotate each thumb in palm. Rotate fingertips in palm. Transportation. High-touch surfaces such as door handles, interior handles, steering wheel, dashboard, and glove box, levers, radio dials, and mic, seatbelt components in the vehicle need to be sanitized twice daily. Everyone travels with the same crew members each day. Sanitize, wash hands before entering vehicle. Travel with windows open when practicable. Do not consume food in the vehicle. If more than 2 people in a vehicle, driver in the front, passenger in the back, opposite to the driver, all of the people in the vehicle must wear a mask. Restricted travel and journey management plans. PPE. Face masks, bandanas, or something similar will be required for specific tasks when physical distancing cannot be maintained and when traveling in vehicles. Gloves will be required to handle shared tools and equipment, paperwork, plus cleaning tasks. Removal of disposable gloves. A how-to guide for the removal of disposable gloves. Pinch and hold the outside of the glove near the wrist area. Peel downwards, away from the wrist, turning the glove inside out. Pull the glove away until it's removed from the hand, holding the inside-out glove with the gloved hand. Continue to pull the glove down over the inside-out glove, being held in your gloved hand. Peel downwards, away from the wrist, turning the glove inside out. With your ungloved hand, slide your fingers under the wrist of the remaining glove. Do not touch the outer surface of the glove. Using dust masks N95 properly. Use a dust mask to protect from dust particles or similar respirable particle hazards. Dust masks must be worn properly to effectively control respirable particle hazards like dust. Dust masks work better when a person is clean-shaven. Dust masks N95 will also assist medical personnel from protecting contamination with COVID-19 in spit and fluids. These respirators are not for use with beards or other facial hair that prevents direct contact between the face and sealing surface of the respirator. Do not reuse or store for reuse or hang around neck. Discard the mask if you notice difficulty breathing while wearing the mask. Over time, dust particles will cover the mask. Discard the dust mask when this occurs. Hold the respirator in hand when molded nose contour, narrow end at fingertips, allowing head straps to fall below hand. Using an N95 dust mask continued. Place respirator under chin with nose piece up. Flange must not be creased inside respirator. Raise top strap to top back of head. Pull shorter bottom strap overhead, below ears, to around neck. Do not wear with only one strap. Adjust respirator for comfortable fit. Each time user enters contaminated area, seals should be fit checked. Cover the front of the respirator by cupping both hands. Inhale sharply. A negative pressure should be felt inside the respirator. If any leakage is detected at respirator edges, adjust the straps by pulling back along sides or reposition respirator. Repeat until sealed properly, otherwise see your supervisor. Entry into a contaminated area with an improper fit may result in sickness or death. Removing a bandana or cloth mask. To remove, pinch from the outside to avoid touching the inside of the bandana. Never wear inside out, and wash daily. Accommodations. One person room or one pair, a couple per room whenever possible. If sharing a room with two people who are not a family unit, beds must be placed 6 feet apart and head to toe, or erect a curtain between the beds. Dining should be staggered when workers sharing kitchen who are not a family unit. Kitchen must be cleaned and sanitized after each use. Different set of dedicated dishes and utensils must be kept for each individual or couple. Occupants must clean their room weekly prior to a final departure. High-touch areas in the room must be cleaned daily by the occupants of the room. No visitors in rooms. Garbage must be removed on a daily basis. Workers must travel back and forth to the work site in the same vehicle. Community interface. Blue-collar camps respects that communities may be fearful of groups of people coming into their town during this period of time, and we would like to reduce that fear while still adding to the economic benefits of us working in the community. We also need to protect our workforce from potential community contamination so our workers do not become sick. Journey management plans strictly monitored and documented for everyone coming out to start the project. pre-screening questionnaires. You may need to delay your travel if you have been exposed. Reduce community interface and any potential contamination when traveling and fueling. Restricted access to communities. Limit shopping and town activities. Where possible, designate one person to complete shopping activities. These activities should be planned and staggered. If you get sick while working, first, all of the procedures and precautions developed are intended to prevent anyone from becoming contaminated. Frequently washing hands, sanitizing, and preventing any cross-contamination with food, water, plus physical distancing. Second, if you present with mild symptoms, an isolation room setting will be provided for you to get well while not contaminating anyone else, including regularly served meals. Third, if seriously ill but not requiring medical aid, a quarantine motel room will be provided to you to better address your healing while supported with meals. Fourth, we will be utilizing the provincially provided self-assessment tool to monitor your well-being should medical aid be required. We will utilize the ETV, first aid, and medical responders, emergency services in case of a medical emergency. COVID management and procedures. Screen all employees prior to accessing work sites. Increase sanitation efforts at common areas like eating facilities. In worksite settings, hired additional help to complete required camp sanitation schedules. In increased sanitation handles, shared surfaces, and transportation vehicles. Provide isolation techniques where required and quarantine techniques if necessary. For more information, please visit the following websites.